Así es, queridos amigos, muy buenas tardes. Bienvenidos a Montgomery al Día, su programa oficial del gobierno del condado de Montgomery, galardonado a nivel nacional. Y como cada martes a las 2 de la tarde, acá su presentadora y portavoz hispana de este condado, Lorna Virgilí. Muchísimas gracias por esa sintonía y recuerden que estamos en vivo en el Facebook Live de Radio América. Aunque ustedes no lo crean, ya vamos a cumplir el segundo aniversario que venimos dándole frente a la pandemia del COVID-19 acá en nuestro condado de Montgomery. Y para hablar sobre ese tema específicamente, tenemos con nosotros un invitado especial. We have a very special guest today. Se trata del director del Departamento de Salud del condado de Montgomery, el doctor Raymond Crowel, quien nos acompaña. Bienvenido, doctor. How are you?
I'm fine. How are you today, Lorna?
Very well, thank you. That was a long intro. It always is. And first thing we do here in the show is check in with the guests. How are you doing? You look youthful. You look rested. You look good.
Yeah.
Believe it or not.
Your story is touching. I wish it were true. I'm well, thank you. I think it's been an intense and challenging 2 years, but so far, with all the help and support I've gotten to back me up in my work, I'm doing fine. I'm doing well.
Acá preguntándole cómo está el director del Departamento de Salud del Condado de Montgomery. Está bien, gracias al apoyo que ha recibido, aunque no lo crean. Este señor le ha tocado trabajar muy arduamente dándole frente a esta pandemia, como se pueden imaginar, nuestro Departamento de Salud. It seems like it was yesterday, March 6, 2020. It's going to be exactly 2 years ago when that first press release came out saying that the state was telling the county that there might have been some sort of exposure to COVID-19 here in Montgomery County. Mm-hmm. It's been a long way ever since. Your department, in particular, has been working tirelessly to bring information and resources to county residents. Looking back at the last 2 years, Dr. Crowel, what moments would you say have impacted you the most?
Yeah, exactly. There are so many. I think I was at a dinner the night we got the first call that we had 3 cases, and it launched us into a conversation. And I was at a dinner at the National Cathedral, a fundraiser, and learned within the week that I was in the room with someone who had been one of the index cases in D.C., in Washington, D.C., at the church in Washington, D.C. And I thought, oh, okay. It turns out it was fine. I was nowhere near them as it worked out, but it was a sobering moment about how easy it would be for this vaccine to sneak up on us, and how little we understood that. I think that there was a lot of fear and anxiety. Oh, I'm sorry. Yes, let me stop. Okay.
Le preguntaba a él que va a ser justo 2 años, el día 6 de marzo, ahorita, unos días, que se cumple el segundo aniversario. A través de estos 2 años, obviamente, el Departamento de Salud ha trabajado incansablemente para traer recursos, información a la población. Nos dice el director Crowel que fue justo ese día, él estaba en un evento en la Catedral Nacional en Washington, D.C., en una cena de recaudación de fondos, cuando recibió la llamada de esos primeros 3 casos que se reportaron acá en el condado de Montgomery. Posteriormente se entera de que él había estado en una iglesia, en una congregación también en Washington, donde habían suscitado casos, y ahí fue cuando comenzaron a comprender las autoridades lo fácil que era la propagación de este virus. So going back to those moments impacting, that initial call, the fact that you might have been exposed yourself, and then moving forward with all that your department has done, what have been some of those impacting moments, Dr. Crowel?
So I think that there were personal losses. There was a lot of anxiety. The need to get it right was certainly has always been a driving force throughout this for us. But I think there were personal losses. I remember losing a staff member in our central office at HHS. And how stunning that was. And then in April of 2020, I lost my sister to COVID.
I'm so sorry to hear that. I did not know.
It was a painful moment. No family could be with her while she was ill in the hospital, and no one could be in the room at the funeral. And I couldn't be with the family at the funeral because it was all virtual. And then knowing that that was repeating all across the country and all across the county was really sobering and gave me a clear sense of the thing that we needed to fight. And so I'll stop there for a second.
Yeah, let me go ahead and translate. And once again, I'm so sorry about your loss. Le preguntaba en momentos más impactantes, obviamente la ansiedad que presentó, ¿no? El saber que venía esta pandemia, las pérdidas personales, en el caso de él, pérdida de un empleado del Departamento de Salud, pero más allegadamente la pérdida de su propia hermana, producto del COVID-19, víctima del COVID-19, y en ese momento en particular, pues no se podía visitarla a ella en el hospital. Cuando fue el funeral, fue virtual, no pudieron estar presentes, así que nuestro director del Departamento de Salud, el doctor Raymond Crowel, pues ha vivido en carne propia lo que es la pérdida personal producto del COVID-19. How difficult, Dr. Crowel, was it transitioning once the county started teleworking, the closures, the cancellations, the service reductions? How difficult or challenging was it to continue offering some of the services that your department offers and then engaging into what was next? Distribution of PPE, testing, and vaccination eventually.
All of those things. Before I move off of the impactful things, I do want to say that the lives being saved, watching the first tests and the first vaccines being rolled out, and seeing the tears of joy in my staff's eyes at being able to do something that would save people's lives was a moment that I will never forget.
Algo que también para él ha sido impactante fue una vez que comenzaron las pruebas del COVID-19, las vacunas, ver la alegría que tenían los miembros de su personal del Departamento de Salud porque estaban pudiendo salvar vidas, ha sido una de las memorias que a él también le impactan más. Estamos conversando con el doctor Raymond Crowel, que es el director del Departamento de Salud del Condado de Montgomery, y estamos en miras al segundo aniversario de darle frente a esta pandemia. Él es invitado especial en este día precisamente porque su departamento ha tomado el liderazgo en cuanto a darle frente a la pandemia. Okay, so again, engaging your personnel, keeping them motivated as things have transitioned during the last 24 plus months.
You know, it is really amazing. There were a lot of challenges in going to closing things down and coming to telework. But I have to say that the 1,800 employees at HHS were phenomenal. They pivoted immediately to doing other things and finding new ways to do the work. They went to telework, and we had enormous challenges with getting equipment for teleworking. But they also pivoted to doing testing and vaccination and support for us for as opposed to their regular jobs.
El personal, él habla en este momento sobre precisamente el personal del Departamento de Salud nuestro en el condado. Increíble, pese a los retos, pese a que se implementó el teletrabajo, todas las clausuras que hubieron, las reducciones de servicio, el personal fue fenomenal. De acuerdo al director, transicionó inmediatamente a teletrabajar y posteriormente a lo que fue ya el proceso de pruebas y de vacunación en el condado de Montgomery. So kudos to your personnel. I know they've been working really hard. We try to acknowledge them often enough, but this is a fantastic opportunity. So thank you very much for doing so right now. Let's talk a little bit as to where we stand today. Things change on a daily basis, as we know, but the pulse report, where are we today as far as the positivity rate and also the number of cases in the county?
So we are rapidly coming out of this most recent surge, thanks to Omicron, and I think the numbers at this point where's my case rate information? I want to make sure that I get it right and tell it to you, give you the
I think
straight
the test
scoop.
positivity rate right now is at 1.92.
The test positivity rate is 1.92. I tend to track less the test positivity rate at this point and more looking at the case rates and the admissions to hospitals in line with the new CDC guidelines around this. So we're now down to 61 cases per 100,000 that are contracting COVID in any given 7-day period, and that is down from somewhere just south of, I want to say, 1,000 a day at the peak of this virus.
At the beginning of the year, right? Yeah.
Yes, at the beginning of the year. So it's come down substantially. So we are coming out of this. Our new admissions rates are down to 3 per 100,000. And the numbers of people who are in beds that are hospitalized with COVID in an ICU bed is down to about 6%. So we are fast coming out of this recent surge.
Son buenas noticias en cuanto a dónde estamos en este momento, en cuanto a las cifras del COVID-19. Como ustedes saben, hubo un auge a principios de año con la variante Omicron, pero pese a eso, pues rápidamente están disminuyendo las cifras en el condado de Montgomery. La cantidad de personas positivos por cada 100,000 está en 61, en comparación en un poquito menos de 1,000 que estaba para el mes de enero. A la misma vez, las hospitalizaciones, 3 de cada 100,000 residentes del condado de Montgomery, y la utilización de las camas, en la unidad de cuidado intensivo está aproximadamente al 6%. So, esos son buenas noticias, alentadoras, positivo. Now that the mask mandate was lifted in the county, there's still some recommendations for those who are not vaccinated, as well as perhaps you can give some of the guidelines that you've been sharing with MCPS, Montgomery County Public Schools, when it comes to the possibility of them lifting the mask mandate, and also the considerations when it comes to children and youth that have health considerations.
So our health officer, Dr. Bridgers, and his team and I have been talking with the Montgomery County Public Schools administration and to some extent the Board of Education about recommendations and about masking and social isolation and social distancing and guidance. It's not a matter of if mask mandate is going to be lifted. It's more a matter of when. I think and we all are looking forward to that point. But I'm sure that MCPS will make masks an option for folks, so that they want to wear them, they can. And I'm going to encourage family members this is where personal choice and anxiety and comfort play in. A single mask, an N95 well-fitted mask will protect you, or KN95 will protect you as well, not as well as 2 masks. Everybody was masked up, but it will give you adequate protection in this current environment that we're in. And so people have to, I want to encourage people, if they're anxious, they should have their students mask up, their children mask up, and wear masks when they're in the classroom settings.
Le preguntaba sobre el hecho, ¿no?, de que se ha levantado lo que es el mandato, el requisito de utilizar cobertura facial en el condado de Montgomery. Voy a recapitular un poquito lo que acaba de decir el director Raymond Crowel, que es el director de nuestro Departamento de Salud. Las recomendaciones que se le han estado dando a la Junta de Educación del Condado, al sistema de las escuelas públicas, en cuanto a lo que es igualmente levantar el mandato de la utilización de las mascarillas para los niños y jóvenes en los colegios. Nos dice el doctor Crowel que ellos han estado obviamente en comunicación con la Junta de Educación y lo que es la rama administrativa de las escuelas públicas. No es si se va a levantar el mandato, es ahorita cuándo. Siempre recordando que las mascarillas N95 y KN95 continúan siendo una protección adecuada en contra de este virus. Can we talk about vaccination status linked to death and highlighting the protective effect from being fully boosted? I know the county is trying to spearhead another campaign reminding county residents to get boosted. Among our Latino community, we have seen some initial numbers of rates of vaccination extremely high, but not so much with boosting. So what is the message for the community when it comes to getting boosted?
So I think that we're seeing this not just in our Latino community, but we're seeing it across the country and across the county that people are getting boosted at lower rates than they were getting vaccinated, first and second doses for vaccinations. And I think the message here is that the evidence is clear from this most recent surge. If you are unvaccinated, you are 13 times the risk of testing positive for COVID-19. And according to some of the data, 68% times higher risk of dying from COVID compared to vaccinated adults who were boosted. So the message, yeah.
Let me go ahead and translate that.
Okay.
Básicamente le preguntaba el hecho de que las tasas de vacunación, sobre todo nosotros los latinos, originalmente fueron bastante elevadas, pero con la vacuna de refuerzo, sin embargo, no lo son. Contestaba el director Raymond Crowel de que esta no es solamente nuestra comunidad latina en el condado, sino que también a través del país y del condado, las tasas de vacunación con la vacuna de refuerzo ha sido una tendencia a ser menos. Ahora, el mensaje continúa siendo evidencia clara de la importancia de la protección añadida que ofrece la vacuna de refuerzo. ¿Por qué? Si usted no tiene la vacuna de refuerzo, está a riesgo 13 veces más a riesgo de contraer el virus. Si no la tiene puesta, también está 68% más a riesgo, de acuerdo a las estadísticas, de morir, de fallecer, si le da el COVID-19. Así que el recordatorio continúa siendo de que el departamento, the County Department of Health, continues granting the free vaccination clinics throughout the county. Así que es importante que las personas estén conscientes de que aún se ofrecen las vacunas, incluyendo la de refuerzo. So moving forward and talking about vaccination, how is the department getting ready for the 5-year-old and under vaccination, which is anticipated perhaps to happen in the month of April, coming up soon?
So we're looking forward to that. We have our teams now working on planning and working with the CDC and with the state on understanding how this is going to roll out and what the procedures will be for the vaccines once it's approved and disseminated. We will shift as each time we roll out a new age range for vaccination, it's like starting all over again. And so there will be, we will do announcements and we will make clinics available and we will identify where those clinics are. And we will make sure that our staff are well trained to be able to administer the vaccines. And we will continue to partner with our Latino Health Initiative, that's Nuestra Salud y Bienestar, and to get them the vaccines that they need to reach out into the Latino community to vaccinate in places that we might not, that have been overly impacted by COVID throughout this pandemic.
While I translate that, can you try to find out the number of that age bracket, 6 months to 5-year-old, that would qualify in the county? Let me go ahead and translate what you said before.
Okay, I'll see if I can find that.
Hablábamos sobre lo que es la planificación para vacunar a los niños de 6 meses de nacidos hasta 5 años de edad, ya que muy pronto quizás se le va a dar la luz verde a lo que es este proceso y se anticipa que quizás para el mes de abril. Entonces, el Departamento de Salud del Condado de Montgomery continúa trabajando estrechamente con los centros de prevención de enfermedades de los Estados Unidos para el procedimiento de ejecutar la vacunación de este grupo en específico, 6 meses a 5 años de edad. Así que continúa la planificación y a la misma vez, pues también, cada vez que comienza un proceso de vacunación a algún grupo específico, es como comenzar de nuevo, nos decía el director, y van a estar colaborando con la iniciativa por nuestra salud y bienestar, la cual a través de esta pandemia ha estado llegando a zonas específicas de nuestra comunidad para que las personas tengan más acceso a los procesos de vacunación. So that was a long translation to all you said. And do you have a number, perhaps a rough number?
I do. We are currently vaccinating 5 to 11-year-olds now. When the new vaccine rolls out, it will be 6 months to 4-year-olds through 4.
Okay. And do you know more or less how many children are in that group? in the county?
Oh, I don't have a clue in the
Okay.
moment.
All right.
I
We'll
know
figure
I've
that
seen
out.
that,
Not a
but
problem. En este momento, ya ustedes saben, se están vacunando los niños de 4 a 12 años de edad y cuando sea aprobado por el CDC la vacuna para los más pequeñines de la casa, el grupo de 6 meses a 4 años comenzará el proceso de vacunación. Esperamos que para el mes de abril mantengas informado sobre ese tema en particular. Let's talk a little bit about quickly mental health in the county. The county Department of Health has offered some guidance and services throughout the pandemic. Continues to be a big problem. County Council is hosting a mental health forum tonight, precisely because it is a big issue still. How is your department still helping with that?
so we are doing a number of things. Any way we can help with county council, we're working with them around that. But we are also working with MCPS to try to provide more mental health services to students in schools, and also to connect to the broader public. Our crisis center is still in operation. We have a number that people can call 24/7, and you may know this number, but I will share it. It's 240-777-4000. And I would add that there is a hotline. Every Mind runs a county crisis hotline for us, and the suicide prevention hotline that people can call and or chat if they don't want to do voice.
Okay. Conversábamos sobre el tema de salud mental, que ustedes saben que ha batido a muchas personas dentro de nuestra comunidad durante estos 2 años de pandemia, y el Departamento de Salud continúa ofreciendo servicios y guía sobre lo que tiene que ver con salud mental. Colaboran con el sistema de las escuelas públicas del condado de Montgomery. Hoy en la noche precisamente el consejo está auspiciando, los miembros del consejo del condado están auspiciando una reunión comunitaria sobre salud mental, y siempre está disponible la línea telefónica de crisis del condado. Ese número es el 240-777-4000, 240-777-4000, al igual que la línea de prevención de suicidios en el condado de Montgomery, donde las personas pueden conversar con alguien. Let's talk about the county. It's still distributing the rapid test kits at libraries, and also N95 masks, I believe,
That's right.
Throughout the branches and the libraries. The hours change, correct?
I think the hours have changed. I don't know what the current hours are right now, but they have changed. And
All day.
Sure that,
Well, they're open.
I think they have now moved from sort of stand-up particular points to having them in stock by the librarians, and their librarians are just giving them out. So if you need them, you can get them there.
Exactamente. Recordamos, ¿no?, que en abril del año 2020 era extremadamente difícil encontrar lo que son los equipos de protección personal, las mascarillas, recuerdan, ¿verdad? Pues ahorita las bibliotecas públicas del condado de Montgomery continúan precisamente en la distribución de mascarillas N95 para nuestros residentes, al igual que los kits de pruebas rápidas. Han cambiado los horarios en las sucursales de las bibliotecas, y ahorita ellos tienen suministros, y mientras las bibliotecas están abiertas en los horarios normales, están distribuyendo a aquellas personas que lo necesitan. Let's talk about now the rental assistance program, which your department actually was the one in charge of going through the requests from county residents and also dispersing funds. How much money has the county disbursed thus far in rental assistance? Do you have that number?
Sure do. To this point, the county has, and the department working with my team at Services to End and Prevent Homelessness, has distributed $71.1 million in payments to families, to households, to prevent eviction throughout this pandemic. And that's about just shy of 9,800 households. So just shy of 10,000 households that have gotten funding and support to try to keep themselves in their houses and to deal with any arrearages in their rent.
El programa de asistencia con el pago del alquiler ha sido uno de los que ha manejado directamente el Departamento de Salud del Condado de Montgomery, y hasta la fecha han ya canalizado 71.1 millones de dólares a unas 9.800 familias, precisamente para evitar que sean desalojadas. That program closed December 31st last year with a promise that it might open again at some point, sometimes this year.
Yes.
Any updates on that?
Sure. We are waiting. We had to wait until we got our new updated funding, our next round of funding from the federal government, and we're finalizing the paperwork on that now. The state is also giving us additional funding, and I believe, I don't know quite what the number is. I think it's somewhere in the neighborhood of a total of $40 million, and we anticipate that will open up sometime within. In an ideal world, we had hoped to be open now, but we had some delays, so it's gonna be a while. But we expect that it will open sometime late March to early April is our target.
Okay. All righty. I know there are a lot of people waiting for that. El programa de la asistencia con el alquiler cerró el 31 de diciembre del año pasado. Se han canalizado más de 71 millones de dólares a familias en nuestro condado y ahorita se está esperando fondos federales y finalizando el papeleo con el estado de Maryland también para recibir fondos. Se estima la posibilidad de recibir otros 40 millones de dólares y esto se va a comenzar a canalizar a partir de finales de este mes de marzo o para principios de abril. Director Crowel, there is so much more we could cover that your department has done during the pandemic. We have about 3 minutes left. Let's talk about and highlight some of the events that are going to take place this month precisely to highlight basically the 2 years where the county has been, well, all the efforts during the pandemic. So we have something happening today. Do you want to break news?
Sure.
And not today, I'm sorry, this week.
No. I was going to say it's this week. So each week we'll be doing something different as part of this vigil. And starting this week, there will be a candlelight vigil on Thursday, March the 3rd at 7 p.m. at Marion Fryer Town Plaza in Wheaton, to honor those we've lost in the last 2 years. So this week will be about memorializing the people that we've lost. The following week, March 6th, we'll be doing acknowledging Public Health and Healthcare Week and honoring people who, throughout my department and other places in the county that have worked, and like hospitals, that have worked to save and protect the lives of people through the pandemic. The following week, the 13th, will highlight efforts by people and organizations that made sure that people had a place to live and didn't get displaced during the pandemic. And then we will go on in the following week to honor essential workers, the people who stayed on the duty in the face of COVID. And then finally, we will wrap up at the end of March with Food Security Week and acknowledging and recognizing the individuals and organizations that have provided necessities to keep our families fed and in stock of the things that they needed throughout this pandemic. So it's a whole month of saying thank you and remembering.
Este mes de marzo en el condado de Montgomery se va a dedicar precisamente a agradecer a aquellas personas, individuos, entidades que han estado colaborando en los esfuerzos precisamente durante esta pandemia para asistir a nuestra comunidad. Esta semana en particular es una semana en memoria a los fallecidos del COVID-19 en nuestro condado, que aproximadamente unos 1,987 residentes del condado de Montgomery fallecieron producto de la pandemia. Este día jueves 3 de marzo va a haber una vigilia con candelitas, con velas a las 7 de la noche en la Plaza Marion Fryer, localizada al lado de la estación del metro en el corazón del distrito empresarial de Wheaton. Posteriormente, la semana del 6 al 12 de marzo va a haber, se va a resaltar el trabajo del personal de sanidad y hospitales a la par que el Departamento de Salud del Condado de Montgomery. La siguiente semana se va a resaltar el trabajo de los trabajadores esenciales y las últimas semanas del mes de marzo, las personas que han estado trabajando con el tema de la seguridad alimentaria. Dr. Crowel, it's 2:30. Our time is up. Thank you so much for joining us today. We will see you on Thursday evening at the vigil in downtown Wheaton. Once again, very sorry about your personal losses during this pandemic. And thank you for your leadership in your department. Thank you.
Thank you. Thank you, Lorna. And please stay safe.
Thank you. Muy buenas tardes. Nos vemos el próximo martes. Los esperamos el jueves a las 7 de la noche en la Plaza Marian Fryer, en el corazón de Wheaton. Buenas tardes. Good afternoon, everyone.